My name is Dr. Stacy Tessler Lindau. I'm an associate professor in the departments of obstetrics and gynecology and medicine geriatrics. I'm principal investigator for the Southside Health and Vitality Study. So the Southside Health and Vitality Studies is a family of interrelated research projects. And one important question for us was, what is the current status of health on the south side of Chicago today? Unfortunately, there were no existing data sets to really answer that question with a tremendous amount of certainty. But we were concerned, based on the data we had available, that health was not as good on the south side of Chicago as it should be. It's not as good as it is on the north side of Chicago, let's say, or as compared to national averages. So we conducted this study at this time in order to understand the baseline. Where are we starting now as we begin efforts to really transform the health and vitality of people living on the south side of Chicago? First of all, with respect to the study, cooperation rates were high. People were willing to participate even under difficult circumstances, and if they participated, they were very cooperative in terms of participating in the collection of blood spots for the hemoglobin A1C test, the blood pressure measures. People were interested to know that that information would help us really understand health on the south side of Chicago. People rated their health fairly high, both their physical health and their emotional health. Again, even under pretty difficult circumstances. The study was done between 2012 and 2013. The economy's been rough, but nonetheless, people had a fair bit of optimism, and I think that's an important observation that needs to be leveraged as we move forward. On the other hand, we found a good deal of undiagnosed disease. About a quarter of people had pre-diabetes, and the vast majority of these people had no idea that they had pre-diabetes. About a quarter of people had diabetes, and again, a lot of those individuals didn't know they had it. One of the exciting areas for this study that's really time sensitive is we looked at technology use among people living on the south side of Chicago. And this changes so rapidly that we have to make use of this information quickly in order for it to be valuable. But what we found was almost every single person we interviewed had a cell phone. People were mainly using cell phones with the text messaging functionality. Fewer people were using the internet or apps, mobile apps on their cell phones. But that tells us, as physicians and people interested in improving community health, that the text messaging component of the cell phone is a very important way to reach people around their health. And so we are looking at this as a strategy for population health improvement. The Southside Health and Vitality Studies has an important project called Community RX. And Community RX is a project that's connecting healthcare facilities to the resources of the community to help people better manage their health or manage with disease if they need to. The population health study gave us insight to the kinds of conditions people need help with. We also were able to ask people during the population health study, if somebody gave you a prescription for resources in your community, would you use it? How would you use it? What would you like to see on this prescription? And we used information from those interviews to actually improve the Community RX project. Next step is to reach as many people and patients as possible with the Community RX intervention. We would like for every patient getting care on the south side of Chicago every day to leave the doctor's office with a very clear understanding of the resources he or she can use in the community to stay well. Next, we would like for community-based service providers to really understand how the programs they're offering meet the needs of the community and where there are opportunities to maybe tailor programming and offerings so that people have attention to the gaps that we've identified. Of course, over time, we'd like to repeat the population health study and show fewer people have prediabetes, fewer people have diabetes, more people are well. That's the ultimate goal.